When a patient's considering a dental implant, there's a lot more that goes into it than cost, right? The number of visits, the number of steps, how much chair time, how much length, am I going to be without a tooth or have a temporary? The technology and the techniques are changing so quickly. Since I have the ability to place the implant and restore it, it gives me better outcome for sure because I control it. We have XNav technology that is computer guided for implant placement. The other thing is that with techniques now, most patients would have the tooth removed, then they would have the site grafted. Then 3 to 4 months later, the implant's placed, and 3 to 4 months later, you would get the final restoration. The latest teachings and technology and techniques were actually, I would say over 90% of the time, removing the tooth, placing the implant, grafting, sometimes with the temporary in one visit. And then 3 to 4 months later, the temporary is removed and the permanent restoration is placed on it. The specialists are very good at what they do. They remove teeth and they graft. But as far as with single implants, very few are taking it that far where they place it the same day and even put a temporary on. From that standpoint, we're very cutting edge and ahead of the dental implants have become the gold standard for tooth replacement. Back in the day when I first started 30 years ago, a lot of teeth were replaced where you would kind of cut down the neighboring teeth and do a bridge, and you would connect that together. And unfortunately, all we were doing is making a 1-tooth problem a 3-tooth problem. And when that restoration failed 10 to 15 years down the road, half the time the tooth that was connected to either side of that bridge went with it. The bridge did not address continued bone loss when you lost the tooth. The way we take out teeth, the way we put the implant in and we graft it, we're preserving the bone, better health, better function. I would rather not even consider placing a bridge and have the patient leave the space before it would damage good teeth. Today, when implants are placed, the standard is becoming more guided. Earlier, we would do more freehand, but guided surgery is the way of the future. There's 2 ways with guided surgery. On the all-on-X bigger cases, we'll actually use a stent that's computer generated. And for 1 or 2, possibly 3 implants, we have something called XNav technology, where it's kind of like a GPS guided computer system where we pre-plan on a computer screen where the implants go. And then that XNav system guides my hand under a camera. Healing's quicker, painless. Most of the time, there's no need for sutures. Next day, patient may be a little bit sore. They're back to normal function. Patients can expect probably 90% of the time that when the tooth is removed, grafted, and the implant's placed in a temporary plate put on top, it's virtually indistinguishable from when they walked in. A lot of it has to do with the technique for sure, but that's where dentistry is headed. The fact that everything's done here, I have the ability to craft it and make it look like a real tooth on that day. So I think a concern a lot of patients have is, will I be without a tooth? How is it going to look in my smile? Depending on the situation, a lot of times, especially in the office with this new technique where we're putting the implant in the same day, we can actually put a temporary on the implant that day. People are very self-conscious of their smile. People don't want to go without a tooth. If you're contemplating you're in a situation where you have to lose a tooth, the implant is the gold standard best solution. And what I would say is do it now. Do not have the tooth removed thinking you're going to come back and have the implant placed a year or 2 down the road. The best time is then. The implant goes in. The bone structure stays intact if it's done immediately. Waiting and delaying can only cost you more money, more procedures, and sometimes you actually lose the ability to have the implant placed. Implants have become the gold standard. When you lose a tooth or you lose teeth, the big concern is losing bone. And losing bone can affect facial features. So I had a patient come to me, bicycle accident, and she went over the handlebars. She came in the office hysterical, but she had the tooth. And so, we calmed her down. I was able to work in my schedule. We removed the other part. We call that the crown. Put the implant in that day. Grafted around it, glued it to the implant, but she held the mirror up. She was in tears. She could not believe. You could not tell. So if it's handled correctly and it's handled in a timely manner, you really can't even tell that it's been done. So I know patients have lots of options when it comes to choosing a dentist. But we've created a culture here. You will never be taken care of. You'll never be better cared for. The technology, the efficiency. I love what I do. I love making people smile. I love giving the gifts that God has given me back and sharing them. And we change lives. Doing this for 30 years and I just keep learning and we just keep getting better. So I invite you, give us a chance. You'll love us.